world over, there has been growing concern on the widespread of HIV and AIDS. The bottom line, however, is the fact that AIDS is real. Scientists and medical experts all over the world have taken on the challenge of discovering and developing reliable medicaments to combat the scourge. Nigeria, one of the largest countries in Africa, is not immune to this infection, with an approximate figure of 3.5 million of our citizens living with HIV and AIDS. HIV is known to affect women and children more than men, especially in the developing countries such as Nigeria. Of the young who are infected by HIV, quite a large percentage is through the transmission of the virus from a pregnant mother to the child. Mother-to-child transmissions of the HIV may occur in the mother's womb during delivery or through breastfeeding. In high-income countries, mother-to-child transmission (pmtct) has been virtually eliminated thanks to effective voluntary testing and counseling, access to antiretroviral therapy, safe delivery practices, and the widespread availability and safe use of breast milk substitutes. If these interventions were used worldwide, they could save the lives of thousands of children each year. In Nigeria, mother-to-child transmissions make up 10% of HIV transmissions each year. This means that 25 to 45% of Nigerian babies born to HIV-positive mothers are infected. For HIV-positive women who want to have a child, the prevention of mother-to-child transmission (pmtct) is an avenue to ensure a healthy and, in most cases, HIV-negative baby. The goal of this initiative are to prevent HIV infection among prospective parents, avoid unintended pregnancies among HIV-positive women, and prevent the transmission of HIV from HIV-positive mothers to their infants during pregnancy, labor, delivery, and breastfeeding. Dr. Oliver Ezechi reiterates the need for prevention of mother-to-child transmission (pmtct) and what the program aims at.
PMCTC, most times people will say PMCTC, actually means prevention of mother-to-child transmission of HIV infections. We know that if a mother is positive for HIV, she can transmit the virus to the baby, and there are proven methods to make sure that HIV positive mothers can have HIV negative babies, and that's what PMCT is all about.
Dr. Regina Oladokun of the University College Hospital Ibadan discusses the importance of the PMTCT as well.
The goal is to reduce the number of children who will end up becoming HIV positive themselves by preventing the transmission. So starting with their mothers, when they are tested, these mothers are tested so that at least they'll know their status, whether they are HIV positive or not. So if they are HIV positive, then they can access these programs that can prevent the mother-to-child transmission.
Women who have reached stages of HIV infection can require a combination of antiretroviral drugs for their own health. This treatment, which must be taken every day for the rest of a woman's life, is also highly effective at reducing the risk of mother-to-child transmission. Women who require treatment will usually be advised to take it, beginning either immediately or after the first trimester. Their newborn babies will usually be given a course of treatment for the first few days or week of life to lower the risk even further. Pregnant women who do not yet need treatment for their own HIV infection can take a short course of drugs to help protect their unborn babies. The main options are outlined in order of complexity and effectiveness. Mrs. Jaja from Lagos and Hawa Ego, who resides in Jos, share their experience of being introduced to PMTCT and how their pregnancies were managed.
From PEFA, they have counseled us from the beginning. You've known everything from the beginning, and you are not going to to PMC. We are now going to go to PMTct2. When I got there, they didn't let them to know anything. People living negative, they didn't let them to know anything about it, about my stature. Before I was aiming that maybe I would do CS, but my daughter told me I'm going to do CS, and later now asked me what is my viral load and my CD4 and I told him my viral load is undetectable and my CD4 too is high, and the doctor said yes, I can have my baby by myself, and I have it by myself. I'm not breastfeeding. I'm not breastfeeding my child at all.
Even as you are having this virus, that does not stop you from having the children you want to have. But the only way you can have them without being them infected is when you take your drugs. First of all, you have to know your problem. And when you know your problem, you take a solution to that problem. And by the time you get the solution to that problem, that is the treatment. You take your treatment the way you have agreed it with your counselors or your doctors. And if you adhere to your treatment, you see that you can have your children. And even we have those of us that are positive. Maybe the wife is positive, the husband is negative, and you see that they have their children.
For HIV positive mothers, the choice is up to them as to whether they want to breastfeed or use the replacement feeding for their babies. HIV positive women who choose not to breastfeed should be supported by medical staff, managers, their partners, that is, husbands, and receive help to deal with possible stigmas in communities where breastfeeding is the norm. Healthcare workers should also support HIV positive women who choose to continue breastfeeding by preventing and managing breast conditions, including cracked and bleeding nipples. This can be done by helping women to position the baby correctly at the breast and by treating infant mouth problems such as thrush or ulcer immediately. Mrs. Bose Olotu and Fumi Adebisi both reside in Lagos. They share their experience.
I didn't want to do CS anyway. Like I've said before, my first child is 13 years old, so the gap is very, very long, and this baby was big. It was weighing 4.5. Was very big according to the doctor, and she encouraged me to do CS, that to prevent the baby, not 100%, but at least, let's say, give and take 80 to 90% through CS can prevent the baby from getting the infection from mother. I can't breastfeed him, also to prevent him from not getting the infection from me.
They asked me one question here that since I was born, did I sick or did I take any blood, like something? I said yes. In the year 1994, he now said it's okay. So that now reminds me to let my son do the test, because that time we stick together and we still take the blood together at that time.
From the adult clinic, I was referred to the pmtct, where I continued with my antenatal clinics until I put to bed. We kept on observing the child. So the great challenge I had was just the issue of not being able to breastfeed your child, and that was what caused lots of challenges, like friends coming to ask me why you were not breastfeeding. Like my mother had to also ask me, why am I not going to breastfeed my child? My baby needs this breast milk a lot, so why am I not going to breastfeed? I told her my breast milk is infectious, so I need not to breastfeed my child. So there was a time she came with me to the pmtct during one of my son's follow-up. So when she came and saw lots of women, she asked me that, do I mean all these women have the same problem like I do? I said yes, we all don't breastfeed our children, but at the pmtct department, they give us some milk to help us in feeding our children, and if they are not enough, we just buy a little. So what they are helping us with is really helping us a lot, especially for those who are not working. The milk that they give here helps in feeding the children, so that lack of milk will not make a mother just go ahead and breastfeed.
Considering the fact that more than 80% of children who are living with HIV and AIDS obtain the infection from their mothers, either during the course of pregnancy, delivery, or after delivery, the prevention of mother-to-child transmission of HIV aims at reducing the HIV/AIDS pandemic in children by offering various types of intervention to the women, both during pregnancy, during delivery, and after delivery, with the aim of prevention of transmission of the infection to the babies. And we follow the principles of the United Nations General Assembly Declaration, where the first principle is to prevent the HIV infection in women of reproductive age, and secondly, to prevent unwanted pregnancies among women who have been found to be HIV positive. Then thirdly, to offer interventions to women who have become pregnant and are HIV positive, and fourthly, to offer care to babies who are born positive, as well as the entire members of the family, since HIV/AIDS affects the entire family members. So we have various interventions, which include offering of voluntary counseling and testing to pregnant women during the antenatal period. It also involves giving various interventions during the course of pregnancy, and also during the course of delivery, as well as when the baby is born. There are interventions we offer to the babies to ensure that the chances of their being infected are much reduced.
A medical expert, Dr. Ezechi, says that even when pmtct services are available, not all women receive the full benefit. Reasons for HIV-positive pregnant women not accessing drugs include refusing to take an HIV test, not returning for follow-up visits, and not adhering to self-administered drugs. A woman who knows that she or her partner is HIV positive before she becomes pregnant is better able to plan ahead. If she does not want to have a child, then she should consider effective contraception. However, if she decides to become pregnant, then early interventions may be able to help protect her, her partner, and her baby. Doctors will be able to advise which interventions are best suited to her situation and whether she should adjust any treatment she is already receiving. Pregnancy does not make a woman's own health worse in respect of HIV. Being pregnant may cause her CD4 count to drop slightly, but it should return to its pre-pregnancy level soon after the baby is born. Mrs. Bose Olotu and Mrs. Jaja share their experiences in relation to this.
My viral load is undetectable. My viral load was 200 mils as of the last time I did the test, when I was in Luth. So there's this PEFA program there. They ran the test for me. They see the